COVID hospitalizations are climbing in Colorado like they are in few other states right now. Public health experts here point to the more fast-spreading, more serious variants. Yet all seriously sick patients in the hospital are not being tested for those mutations. So Anusha Roy explains the state's certainty that it's the variants that are a problem.
UC Health is confident.
The majority of the positives that we're seeing as a healthcare system are due to the variant.
Dr. Richard Zane gave a specific number for the health system.
Approximately 70% of the positive cases in the last week are due to the B.1.1.7 variant.
The state has long been warning that variants are circulating in our state. But if every positive case is not screened, how do they actually figure that out?
14 or 15% of positives in the state are being sequenced at this point. We're continuing to try and increase that number.
These are random samples from across Colorado processed at both state and commercial labs.
Based on that random sample, we are able to estimate what proportion of positives in the state are due to one variant versus another.
Some hospital systems like Denver Health are then applying that same model to their hospitalization count.
What we already know to be statewide, which is over half of the patients we see.
UC Health has an initial screening process worked into their system.
We have the ability to detect something called an S drop.
It essentially indicates it might be a variant and is then sent to the state to figure out exactly what kind of variant it is.
It follows in a mathematical pattern, and this is how infectious disease works.
It's really much more about public health surveillance.
And Dr. Hurley said tracking the variants is about the big picture to figure out what's circulating in Colorado, guide the state's response, and also use that data for future modeling.
One of the things we know about the B.1.1.7 or UK variant is that it's more transmissible. And so because of that, it could also actually increase the level of vaccination or immunity that we need to reach to reach herd immunity.
So we also asked the state health department, why wouldn't you screen people specifically in the hospital with COVID right now to figure out if they have the variant or not? They got back to me literally in the last 2 or 3 minutes here, and they said that their approach to this is really just to get a broader sample of what is happening across Colorado so they can start comparing things amongst different demographics, across different geographic areas, to get a better sense of what the variants are doing across the entire state. Now, within the hospitals themselves, both doctors, Kyle, said that for the large part, treatment is staying the same for people, whether they have a variant of COVID or not. There's some new recommendations from the FDA, but a lot of similarities at this point. We did take all of these stats, took it to the health department and experts at MSU Denver. They said everything seems to be lining up. And when it comes to getting a good model and being able to project out, the most important thing they said was to get randomized data from across Colorado, which is what the state said that they are doing.
And Anusha, like anything else in the pandemic, people are applying their preconceived notions to the situation. So especially on social media, you'll hear people saying, well, you know, if hospitalizations are going up, I guess those vaccines aren't any good.
Yeah, and we asked both doctors from UC Health and Denver Health about this, and they said, listen, if this fourth wave we're in right now without vaccination, they said it would be way worse than what we're experiencing. So they don't want you to hear all of this and be discouraged. They actually want the opposite to happen, and they want more people to start signing up for their vaccines and making it out to their appointments, because we're still not at a point where enough Coloradans have received their shots.
For sure. Let's talk about those numbers. Anusha, thank you. There may be this perception that, oh, everybody's vaccinated. It's like 31% of our state's population right now that's completed the vaccination process. It is more than 1.8 million people. It's better than some other states. There are 764,000 Coloradans waiting for their second shot of Moderna or Pfizer. 628 people are currently hospitalized in our state with COVID-19. We actually saw a drop of 6 patients from yesterday's total, so let's hope that's the start of a trend. This time last week, we're at 551 patients in our hospitals.